Okay, Chapter 6 talks about syringes and needles. Let's focus on the syringes for a little bit, but I want to start with some vocab here at the beginning of Chapter 6. So, and this is all in your book as well, but I'm just talking about some words that are associated with syringes and needles. The word hypodermic, the definition says that it's a term used to describe injectables that are under the skin. I mean, that's literally what it means. Is hypo is under, dermic is skin. Okay, so these are needles usually that are meant to go under the skin. Not all needles are hypodermic needles. We're going to look at an example later that's not hypodermic, but most of your needles are meant to pierce the skin and go under them. An insulin syringe is a very special syringe. It can have a capacity of 0.3 up to 1 milliliter, and the little calibration markings along the side of it are done in units, not milliliters. Okay, so we only give insulin with an insulin syringe. No other medication is given with an insulin syringe. Intradermal, that's one of your abbreviations that you were supposed to memorize. Now we're going to look at what does it mean to have an injection that goes intradermal. This is a shallow injection, and it's given just under the skin between the dermis and the epidermis. So this is like your TB skin test that you probably had done somewhere along the way. Okay, that's an intradermal. Intramuscular, IM, means that it's going into the muscle, as you can imagine. Those are usually your deeper, more painful shots. Intravenous is going into the vein. That's the one where they hook you up to the IV pole with the bag hanging and all that good stuff. When we get to talking about needles, we refer to the length of the needle, and we also refer to the gauge of the needle. If we're talking about a needle gauge, this is the diameter of the needle shaft. Okay, so whether it's a thin little needle or if it's a thick needle, that's the needle gauge. Now, parental medications, I think we've talked about that word before. Parental basically just means it's going to need a needle, right? You need a parent there to hold down the child if you're going to stick it with a needle. So parental medications are injectable medications. We're also going to look at a pre-filled syringe. Okay, so a lot of your syringes are just empty, but occasionally there are drugs that come pre-filled. So this is a syringe that has been filled by the manufacturer or a pharmacy. Usually it's done with your frequently ordered doses, so like some of your vaccines and stuff, and they'll come pre-filled. Some more vocab. The safety syringe. So a lot of your syringes now, a lot of your needles come with a little locking mechanism that's going to help keep you safe so you don't poke yourself and maybe collect a disease from somebody. Subcutaneous, this is an injectable that goes under the skin but into the fatty layer. It's used for less irritating substances than the intramuscular injection. So, like if you've ever seen anybody give themselves an insulin shot, that's a subcutaneous. A syringe holder. These are specially designed devices that are used with an inserted pre-filled medication cartridge. And again, I've got a picture later. I'll show you what I'm talking about. A tuberculin syringe is a very teeny tiny syringe. It's just 1 milliliter. Okay, think about that 30 ml medicine cup. We're talking about 1 milliliter of medicine. That's all the syringe is going to hold. So it's a very small syringe. We use those for the intradermal skin test, or also small volume injections in the frail at-risk populations like your pediatrics or geriatrics. Viscosity, that's a big word. Viscosity is the ability to flow. So this is the thickness of a solution. So it's kind of like a milkshake versus water, right? Milkshakes are pretty viscous. They're pretty thick. If you've got a highly viscous solution, it says you may have directions to dilute it down. High viscous solutions like blood products and some reconstituted medications may require the use of a larger gauge needle, okay, something a little thicker to be able to handle that viscous solution. Okay, so enough vocab. Let's look at some pictures here. Oral syringes, there's two different types of syringes. These oral syringes are not meant to ever have a needle on them. Okay, this is just a syringe that you can put in the patient's mouth, or they put in their mouth, and you just shoot the medication directly into their mouth. This is what I use a lot with my kiddos. My 2-year-old, I'm not going to give her a medicine cup. I'm just going to pull up some medicine in this oral syringe and shoot it into her mouth. Okay, so they will not ever have a needle on them. If you look at the tip, that's called a slip tip. Okay, the ones that are meant to have a needle on them, that's called a lure lock, and it's going to have a little groove on the tip of it to where you can screw on a needle. Okay, that's a lure lock, but these are just slip tips. So we do not put a needle on those syringes. Now, yes, it is possible to jam a needle onto those syringes, but it's not sterile, it's not safe. They do not recommend that these oral syringes get needles. Okay. So how do we know what syringe to pick? Okay. There are lots of different sizes. I'll back up to that slide again, but lots of different sizes that you can get in syringes. And I know they all look the same to you right here in this picture, but they're not. Okay, this bottom one is a 1 ml syringe. That's 1 milliliter of fluid. Okay, a 3 ml is pretty standard. 5 ml. Okay, they also have a 10 ml and all the way up to a 20 ml. So they come in all different sizes. So how do you know which one you're supposed to pick whenever you're given the medication? Well, the biggest factor is how much medication are you going to give? Okay, the volume of medication to administer. I mean, if you've got to give 4.2 milliliters of something, you can't put it in a 3 ml syringe, right? 4.2 milliliters is too much for that 3 ml syringe. So the volume of medication that you've got to give, that needs to be your biggest indicator. But also the rate of administration. Sometimes when we get to talking later in the IV chapters, if you're doing an IV push, they want you to use a wide barrel because you've got to move real slow with that. So the rate of administration will sometimes affect which barrel, what syringe you're going to pick. The route, how you're supposed to be given this medication. And again, that's typically going to come back to the volume as well, because if you're going with a TB skin test, you're going to be given something less than 1 milliliter. So you're going to be using that 1 ml syringe usually. So route kind of does play into the volume as well. And on these, you've got pictures in your book on these syringe sizes, page 203, 204. You've got all these pictures in there. Now, something I do want you to notice, and we're going to talk about this further in this chapter, but the different little calibration markings on these syringes, they're all different. Okay. Here on the 5 ml syringe, each little calibration counts for a 0.2. Down here, actually, let's do the 3 ml. The 3 ml syringe, you've got 10 little calibrations before you get to 1. So that means each one of these is going to count by 0.1. You go down here in the 1 ml syringe, and you've got all of this to do before it gets to 1 milliliter. So from here to this first big one, that's 0.1, 0.2, 0.3. Okay, so and they've got calibration markings in between. So you can get down to 2 decimal places on that 1 ml syringe. If you're looking at this 20 ml syringe, each one of those calibrations is a whole milliliter, right? From here to there is 5 milliliters. So each one calibration is counting it by ones. All right, so they all count by different things, and like I said, we're going to look at that a little bit later, but let's throw up an insulin syringe here. I want to show you those. Page 204, 205. The insulin syringes can only be used for insulin. Okay, anytime you're given insulin, you have to use an insulin syringe, but you cannot use an insulin syringe for any other medication. Okay, these insulin syringes with their little calibration markings, those are measured in units, not milliliters. Okay, all the other medications we're going to pull up are figured in milliliters. Insulin is the only thing that's measured in units. Okay, so be sure that you're only given insulin in the insulin syringe. Now they come in different sizes. Okay, this top one is a 100 unit syringe. They've got a 50 unit syringe, and they've got a 30 unit syringe. Okay, this 100 units is the same size as your 1 milliliter tuberculin syringe, so don't get those confused. Okay, they're the same size, but this one, the insulin syringes, will say units on it instead of milliliters, and they typically have a different colored cap over their needles. Their needles already come fixed onto that syringe, so you don't insert those on your own, and they come with a special colored cap. The ones that I've seen in the classroom and stuff, they're orange capped. Alright, so they're very special little syringes and needles. I was looking through my notes trying to make sure I'm talking about everything. We talked about how their needles are attached. So whenever you get ready to trash these, the whole thing, needle and syringe, goes into the hazardous waste sharps basket. Okay. Do not confuse the 1 ml syringe for the tuberculin syringe. We talked about that. Yep. Okay. So, I had a picture. The tuberculin syringe, like I said, it's going to be the same size as this 100 unit syringe, insulin syringe, but you'll be able to tell. I mean, down here at the bottom of the tuberculin it says 1 ml. Down here at the bottom of the insulin syringe it says 100 units. Okay, so you'll be able to tell the difference. Just make sure that you're only given insulin in the insulin syringe. Okay, so let's look at some calibration markings. What is the total capacity of this syringe in milliliters? So the whole thing looks like it will hold 3 mils, right? How many calibrations are there between 0 and 0.5? Alright, so between 0 and 0.5 it looks like there's 1, 2, 3, 4 little lines. You actually have to count that last one too. So there are 5 calibration markings. What is the smallest measurable dose on this syringe? So they're talking about from the 0 to this first teeny tiny little line here. How much medication can this one hold? Well, there's a couple different ways you can do this. And I think the easiest is just to guess and count it out. Okay, so if you think, well, from 0 to 1, it looks like there's 10 of those, I think I can do a 0.1. Count it out. 0.1, 0.2, 0.3, 0.4, 0.5 is a half, 0.6, 0.7, 0.8, 0.9, and 1. So yes, it can count by 0.1 mils. If you guess that, you could count by 0.2, so let's try that one. 0.2, 0.4, 0.6, 0.8, 1. No, that one's wrong. Okay. You remember those slip tips we were talking about with the oral medications, the ones that just had a little nose on them? This is an example of a lure lock. I don't know if you guys can see the grooves in here, but your needle would screw on to this lure lock tip. Okay, so this syringe is meant for a needle. Okay, let's try another one of these rapid practice problems. What is the total capacity of this syringe in milliliters? So 5, 10, 15, it looks like it goes all the way up to 20, right? 20 mils. How many calibrations are there between 0 and 5? So again, 1, 2, 3, 4, but we have to count the last one, so 5 mils. And what is the smallest measurable dose? So the first space up to the first line on the syringe. So from 0 to this piece, how much is it counting by? Well, it looks like it's counting by a whole milliliter, right? 1 mil, 2 mil, 3 mil, 4 mil, 5 mil. Yep. Okay, so then they want us to draw a vertical line through the syringe at 1 mil. Well, we said that first little line is 1 mil, right? So you just draw a vertical line, be sure you go from the top to the bottom, cover it all, and make sure it's at the right calibration marking. It says to draw a second vertical line through the syringe at 14 milliliters. So we got 5, 10, 15. 15's too far. We need to back it up by 1, right? And that'll be our 14 milliliters. Okay, I'm going to pause the video. We'll come back to these.